How to support someone with fear of needles. If you know someone struggling with a fear of needles, also known as trypanophobia, you might wonder how to help them. This fear can cause intense anxiety, panic, and even physical reactions like fainting. Supporting them effectively is essential. Let's break down some practical steps you can take to make a difference. First, encourage open communication. Let them talk about their fears without judgment. Acknowledge that their feelings are real and valid. This creates a safe space for them to express their emotions. Encourage them to inform healthcare providers about their fear. This way, providers can use techniques to help, like keeping the needle out of sight or using distraction methods. Next, use cognitive behavioral strategies to help them challenge negative thoughts about needles. For instance, when they think, "This will be unbearable," help them replace that with, "The discomfort is brief and manageable." Reminded them of the purpose of the needle, such as protecting their health. This can help shift their perspective to a more rational one. Gradual exposure to needles is another effective method. Start small by looking at pictures of needles. Then, progress to holding a syringe without a needle. Watching videos of injections can come next, leading up to real-life exposure like receiving an injection. This step-by-step approach, known as systematic desensitization, helps reduce anxiety over time and builds confidence. Incorporating relaxation techniques can also be beneficial during exposure or medical procedures. Encourage them to practice deep breathing, progressive muscle relaxation, or mindfulness. These techniques can help manage physical symptoms of anxiety. Practicing these methods beforehand can empower them to handle their fear more effectively. Distraction can be a great tool during needle procedures. Suggest activities like listening to music, engaging in conversation, or even using virtual reality environments. These distractions can help take their mind off the needle. If their fear is severe, consider professional cognitive behavioral therapy with a trained therapist. Therapists can provide structured support through exposure therapy combined with cognitive restructuring. This helps individuals face their fears gradually while learning to control their anxiety responses. In some cases, short-term medication may be prescribed to manage intense anxiety symptoms, but this should always be guided by a healthcare professional. Additionally, practical steps can help. Staying well hydrated before appointments can prevent fainting, which is a common concern for those with needle fear. Supporting someone with a fear of needles involves empathetic communication, cognitive techniques to challenge fearful thoughts, gradual exposure to needles, relaxation and distraction strategies, and, when necessary, professional therapy. By following these steps, you can help them regain control and reduce their anxiety over time.